I'm really excited to present the San Diego Partners in Prevention team and Aime Zeitz. I know Aime personally and the wonderful work that this team has done. So I will hand it over to Aime so she can share the prevention work that the San Diego team has done. So we're very excited to highlight this today.
You have to unmute me.
You are unmuted, Aime.
Perfect, thank you. Wasn't letting me do that before. Excellent. Well, I'm so glad to be here today and talk about one of my, I want to call it a life passion, I would say. And I hope I do justice to the work our team has done. I'm gonna do my best to represent us, although I know it's not ideal to represent shared work, but I'm gonna do my very best. So like Lydia said, I'm Aime Zeitz. I'm Director of Strategic Advancement with the YMCA here in San Diego County. I've been in social services over 20 years, been in the prevention space for about 15 of those, and educationally my background is as a marriage and family therapist. I'm gonna share today just a little bit about our journey to prevention here in San Diego, and I'm gonna focus both on what we've done and how we've done it. And then I'm going to share a couple of examples that for those of you who are new or early on your prevention journey, maybe they, spark some ideas or spark some conversations that really help you think about what fits for your community. So we can go ahead to the next slide. I am going to start with sort of this historical lens of our journey. So in the 1990s, San Diego was doing a lot of work around family resource centers and really building out that movement. This was before my time here in San Diego, but I understand also had some influence over FRC elevation across the state. And that really allowed us as a community to both I just jumped in on the tail end of Alex's presentation. He's talking about protective factors, and I would say that really grounded our work in FRCs at that time. And then also within our child welfare services, that is when they started their Safety Enhanced Together work. In 2019, we attended the first prevention summit. At that convening, we had about 10 folks from across different sectors, and that group identified the 0 to 5 area as a focus. So when they really looked at child welfare data for San Diego and thought about where is it that we want to or need to make the most impact, that 0 to 5 space is what they identified. And one of our initial opportunities to sort of lean into something specific was around looking at preschool expulsion. So I won't go too deep in that conversation today, other than just to say it is a thing. If you're thinking, oh my God, is preschool expulsion a thing? It is. It disproportionately impacts boys of color, children of color, but specifically boys of color. And data does show that there is a connection to not just the school to prison pipeline, but actually the preschool to prison pipeline. So that was really where we dug in that first year after the prevention summit. And that group's, they named themselves the Pursuit of Happiness. I also wasn't at that convening, but I think there was a challenge to sort of pick a movie name. And what the work of that group, both at the summit and also in the year following, that became the basis of a proposal we submitted for San Diego County to the Children's Bureau for their work. Oh shoot, I forget the formal title, but basically community collaborations to strengthen and preserve families was the funding stream. We submitted this proposal for what we called Partners in Prevention. And what we really wanted to do was to shift from not just prevention to, but actually what Alex was just talking about, building a child, family, and community well-being system. And so I'll walk you through both the contextual pieces that sort of led up to that, but then also what some of that work has looked like since 2019. So if you wouldn't mind advancing the slide, please. So I'm sure many of you have these pieces in mind, but we really thought about where are our strengths. When we were starting our prevention work, we were really thinking about where are our strengths, what do we have in place that we can build off of, and then of course where are the gaps that we want to respond to as we sort of re-envision and reimagine. So within our child welfare services, they were already going through quite a bit of transition. And I would actually call it transformation, of really thinking about how do they get a little bit more upstream. They reconfigured what was their CAPC into a child and family advisory board with a lot more intention and strategy behind it, and some really deep and reflective work for a year or two with heavy involvement from our board of supervisors. So I think that also that gave us an opportunity to elevate prevention. I also, you know, here in San Diego, our early care and education space is pretty, it's fairly robust in terms of our first 5. We have a healthy development services network that includes behavioral and developmental services. And we were doing a lot across our county looking at quality improvement in the early care and education space. And part of that included early childhood mental health, which is a best practice intervention around preschool expulsion. So we sort of bundled all those things together. We thought about how can we leverage those as opportunities to promote and support prevention activities. And then another piece that we have here in San Diego is with our 211 San Diego. We have a community information exchange, which is a shared web-based platform for client level records that supports care coordination. I'll go into more detail in a minute. If we can go to the next slide, please. And then more recently, with AB 2083, we have integrated leadership teams or interagency leadership teams being put in place to really think about these coordinated and comprehensive prevention plans. Of course, thinking about families first and the implications and the opportunities to really, I mean, for us in San Diego, we've been really thinking about how do we re-envision what family support and strengthening looks like, what does family health and well-being look like, and how do we put infrastructure in place around that? So that's really guided our work in FFPSA. And then part of that is also thinking about what other infrastructures do we need in place to have a community prevention hub. So for us, that's been looking at I don't know if folks are familiar with the community response guide process out of Evident Change, but that's both a tool and an engagement process to rethink mandated reporting and really think about what are the infrastructures, processes, relationships, and coordination we need as a community to respond to community needs and family needs outside of child welfare. So we're just starting that right now. I'll talk about community information exchange in just a minute. And then we also have been doing community engagement through something called Our Tomorrows. And this is a web-based platform out of the University of Kansas that allows us to capture and document family stories of experiencing or participating in resources, as well as some so it's qualitative and quantitative data collection that we then visualize into infographics and then host community sense making sessions around. So the idea is really shifting from engaging with community to inform to really co-designing and more authentically partnering with community to understand what's working, what's not working, and how else should it look. And I think we're really trying to integrate that into all the bits and pieces related to prevention and FFPSA. So we can go to the next slide. Okay, so that's kind of the background. So let me take you back to September 30th, 2019, when we got notification of the Partners in Prevention Award, which started on October 1st. So we quickly kicked ourselves into high gear. And one of the first things we did was really think about partner engagement. So who do we need around the table? How do we how do we think about the pursuit of happiness group? Do we keep it? Do we integrate? Do we transition? What does that look like? And how do we do that in a way that honors our values around collaboration? So we put together both, so we went out, we thought about who do we need at table, what perspectives do we need, and for what elements of the project, invited folks, got folks sort of oriented to the work, but also asked, what did we get right? What did we get wrong? What are we missing? And so we didn't really bring a fully baked thing out. We sort of said, like, here's our best thinking today. Now where do we go from here? So we started convening our partners regularly. With our advisory committee, we created a project vision, a definition of prevention. We identified shared values and principles, as well as roles and responsibilities. And I think all of these were really important. While they took time and they were very process oriented, so we didn't get to action right away, I think they were really important in making sure that we had a shared commitment, a shared vision, and that we were really aligned around where it was that we wanted to go together. And then we did some tactical things, like we made sure that we had a theory of change and clear strategies, activities, priorities, outcomes, evaluation plans, all those sorts of things. And a lot of times we would do that work within our team, and then we would bring it to our partners to vet and review and provide feedback and input. And then sometimes we would bring a blank page and say, this is kind of what we're thinking. Do you think this is a good idea? What should this look like? And we would sort of build it from scratch. The other thing we did within the first year of the project was a landscape scan coupled with listening or learning sessions. So this was really looking at, what does the data tell us about what's happening in terms of child and family well-being here in our county? And then we would share that information in learning sessions with community members and community-based organizations to get their perspectives and their hypotheses on that data. Why was it so? What could we do to make it better? As well as other implications on sort of both sides of that lived experience. And then we shared out the learnings from those as widely as possible. We also did integration and alignment with other activities. So we looked at what else is happening across San Diego County or even at the state level, and where is there maybe overlap with the goals and strategies and activities that those efforts have with what we were thinking for partners in prevention. And then really thinking about, okay, then maybe they just hold that and we are a participant, or like we're going to hold this and they're going to like feel like they can take that off their plate. So I think one example of that is Caltrin was awarded the training grant from OCAP, right? And we had proposed to do an integrated learning system for San Diego. And we thought, well, we don't need to recreate the wheel. So we had regular meetings with Caltrin to say, sort of, what are your goals and objectives? Who do you intend to serve? Well, that's kind of what we were thinking. So we don't need to do that anymore, but how can we be helpful? How can we leverage our activities? And one example is they would do a training and then we would host a community of practice support to support implementation. So I think this constant like thinking and rethinking and understanding the landscape has been really important for us. And okay, we'll go ahead to the next slide. I'm going to fly through these just because these are examples and y'all have the slide deck to refer back to, but I mentioned we had put a project vision together. You can see that here. The next slide is the shared values that we identified. So this included both big picture thinking together as well as quite a bit of wordsmithing, as you can imagine. But it's something that we, revisited, still feels very representative of what our values and commitments are to this work together with our partners. The next slide is our shared prevention definition. When we did our initial project kickoff, we heard partners saying, this sounds so great, I'm super into it, but I don't do prevention. And I'm thinking, you do family and support, you do family strengthening and support work. So in my mind, you are doing prevention. So we wanted to create what we called a big tent prevention definition that really anyone serving children and families working on health and well-being, safety, health, and well-being could see themselves in. And so that's what you see here. We also identified primary prevention as our primary focus, specifically for partners in prevention. We didn't want to get caught up or pulled into secondary and tertiary prevention, because there are lots of people already working on that in our community. And so we very clearly defined our area of focus on primary prevention. I think that has helped keep us, I would say, laser focused on our work. All right, we'll go to the next slide. So this is really how we think about our scope of influence in this project. And we think about this always from the inside out. So even if we're doing lots of systems level change, we're always including in the conversation, okay, but what does that change, or what does it feel like for a child and family? What are the impacts to those who provide services? What are the impacts to those organizations? And what do we anticipate could be the impacts at the community level? And so we're also thinking about these levels of engagement in terms of design, co-design, providing feedback on the different pieces of this work. All right, we'll go to the next slide. So these are also, these are grounding principles that we identified with our partners and sort of agreed to them based on consensus. And this is less around sort of what are the values that drive our approach to this work. And these principles are more around our service delivery approaches and what do we aspire to deliver in a high quality and consistent way across our community. And so for this, this felt very equity commitment. All right, so our next slide here is our theory of change. We wanted something really simple to describe this massive thing that we were trying to do. And so the simple story of Partners in Prevention is that we think that if we can help increase family protective factors, we think we can increase family health and well-being and decrease the likelihood of maltreatment. And we think there's a couple things we need to do to make that happen. One is more consistently assess family strengths and needs, connect families in ways that work for them. So that can be where, when, how, and what the service is. We need to do better coordination across sectors, agencies, and services. And then there's some capacity building, right? We want to be able to build sustainability into the things that work about this, this thing that we're going to try. So we'll go ahead to the next slide. I'm sure you all are familiar with protective factors, so I won't go through these, but I will just highlight that this really has been the grounding framework for all of our work. We use that as we think about who should be around the table, how we hold these in mind around ensuring that families have equitable access to each of these protective factors. We can go to the next slide. These are our initial key activities, and I'm going to show you what our current activities are here for 2022 to show you that they have evolved. So the first things that we thought that we wanted to do was convene folks. We wanted to increase coordination and support services. We wanted to get early childhood mental health consultation out there into our community. And we wanted to facilitate family input and feedback early and often. That's where we started. I'm going to take a little bit of a divergent path for a second because I want to describe what our community information exchange looks like here in San Diego, because I think it helps set the stage for the rest of our prevention journey here. So we can go into the next slide here. So the community information exchange is described as an ecosystem. So it's an opportunity for multidisciplinary partners to come together around using shared language, a resource database, so the resources, services, and supports that are out there in our community, and then using an integrated technology platform for enhanced service delivery. And for us in San Diego, for Partners in Prevention, this is really around coordinated care. So we can go to the next slide. This sort of digs into more detail on the specific components which I said before, the network partners, the shared language, the technology, with the end result being really around care, community care planning. The other thing that I have always been sort of enamored with our community information exchange is this bi-directional closed loop referral piece. So 20 plus years in social services, I don't know if others have had this experience, but working with a family, understanding a need, they identify it as a priority for themselves. I provide a referral, could be a warm handoff, and then I don't know what happens, right? Like maybe I'm able to connect with the agencies I have referred to understand what happened, but I can't do that with every single referral I make. I can't expect that of all of my staff. I can't expect that of every other agency. So what the Community Information Exchange allows us to do is make an electronic referral that then we can track what happens with the referral. Did the family, where they lost a follow-up? Were they successfully enrolled? Were they identified as ineligible? So we can track what happened. So then we could circle back with the family and say, hey, that seems like it worked out. Is that your experience? Or it seems like that didn't work. Like, let's go back to the drawing board. Is it still a need? Let's see what else we can find out there. So I think that's been a really powerful component of being able to move this idea forward around making sure families get connected to what they want and need. We'll go ahead to the next slide. One of the things our CIE includes is this risk rating scale. So you can see the domains here. You can see the domains that are sort of evaluated through their call center, as well as the scale of how sort of the immediacy of need. And this is something that's included in all the client level records. So I maybe am assessing on a few domains, but I'm sensing, or the family is saying, I have some other things going on too. These things can be sort of assessed and then reassessed as pre-post as the family gets connected to resources. So just wanted to share that. And if anybody's interested in chatting more about CIE or connecting your 211 to ARC 211, I'm always happy to do that. All right, so I'm going to get back to I just want to take that little side path, and now we're back on the main path. So this is our project infrastructure. So you'll see that the most important and central piece of this visual is our partner network. We started, we had about 25 letters of support for our application. By the time we did our kickoff, we had about 80 participants join us. A year in, we had maybe 250 folks on our email list, and now we have over 400. So we continue to sort of evolve who it is that we're engaging. And we do this through a very cross-sector perspective of thinking about what we always say is prevention lives everywhere and nowhere. And so that means anyone who's interested, come on in and we'll figure out how we work together to support child and family well-being. In addition to that partner network, we have a leadership team that's called our advisory committee. We also have a design team, which consists of our main project leads that you'll see over here on the left. So YMCA serves as the steward of this grant. We work closely with Social Policy Institute at San Diego State University as our consultant. We work with Harder and Company, Community Research, as our evaluator, and we work very closely with our child welfare services team. So that really makes up our design team. We meet monthly to sort of check in and co-design and plan together. We're also doing continuous quality improvement there on both processes and outcomes. And then we have a series of work groups. So this is what we originally proposed when we got started. These work groups here, we have moved forward with an assessment and referral work group. We decided not to move forward with a training work group because we were doing partnership with Caltran. Our community voice work group, we've integrated into all the things that we do. So it's not really a work group. It's just a new sort of strand of our work. We have not yet launched our preschool expulsion work group, but what we'll probably do is in the fall, we'll be launching a early childhood mental health work group to bring sort of stakeholders together around that. And then we also just have, we put ad hocs together. So when we identify a need and we're very clear that we shouldn't be solving anything on our own or thinking about it by ourselves, we'll pull folks together, we'll invite new partners to the table. And so this, I think at the end of our grant will look very different than what we thought at the beginning. So let's go to the next slide. I'm just going to share where we're at with our priorities for this year. We continue to both improve and increase our partner engagement collaboration. So in my mind, that's really about being more inclusive, continue to create this big tent of those who care for children and families and communities, as well as deepen those relationships. And so it's really this quality and quantity that we hold simultaneously. We continue to think about access and utilization of services. So I think this especially shows up in our Families First Prevention Services Act planning of thinking about where are our gaps in San Diego, what's working well, how do we build off and leverage from those? Are there opportunities for alignment that we either know about or don't know about? And how do we just continue to do this better? We also think about or have been doing capacity building, both for those interested in coming on board with community information exchange. We hosted a community of practice and we really just helped agencies walk through the process of like going live with CIE. It took maybe 6 weeks with some consultative support. And then we also provide training and implementation support for what we know are service delivery best practices. So things like strengthening families, trauma-informed care, culturally responsive practice. And we've also been doing a lot of work with healthy outcomes through positive experiences. So the HOPE model out of Tufts University. So we've been getting that content out there and then supporting agencies in implementing, because we really wanted to get away from this train and pray where we just go and then we like cross our fingers that folks are doing things differently. We've also spent a lot of time doing some work from the inside out around equity, inclusion, and lived experience. So when we looked around our leadership table, when we just started our advisory committee, we were mostly white faces. And I'm not saying we didn't have diverse experiences. We did. We had lots of diverse lived experiences, but we did not look like the community of San Diego. And so we've done a lot of work thinking about why is that? What do we need to do differently? What are the ways in which white dominant cultural norms have been perpetuated here? The way we run meetings, the way we invite people, the way we honor the written word, the ways in which we hold boundaries around personal and professional. And so we've been working with an external consultant to really dive deep at a leadership level. So not just our staff, but our core partners as well. And it's been really, really meaningful. I've started to say, I feel like I've turned myself inside out. Like I've been turning my whiteness inside out to just really acknowledge the ways in which it has impacted me as a leader and what I need to get out of the way to really do transformative work. And then the last piece is around early childhood mental health consultation. So we've been doing this work in San Diego in this particular way. We follow the Georgetown model out of Georgetown University for about 3 or 4 years. But we also know that we're never going to meet the need by ourselves as an organization. And so we've made a commitment to really bring others together who are interested in implementing this model to leverage and align and to really build a system of care in our 0 to 5 space here in San Diego. So that's coming up next in the fall. All right, so these are just examples of ways that we visualize our key activities with a little bit more detail. I'm not going to go through these. You can skip through this and the next slide. And I want to just spend a little bit of time on reflections and then any questions. So we can go to the next slide. I wanted to just highlight a couple of what we consider our success factors. And I also just want to say I didn't make these up by myself. We had a meeting with our core team last week, and they helped identify this and the next couple of slides that you'll see. So I'm just the voice of it. So I think we think that this role definition, actually just roles and responsibilities in general, have been really important. So the YMCA before this opportunity was not deeply entrenched in the prevention space. We were a funded partner of child welfare, but we were not a consistent participant in big picture thinking or strategic planning. And so in a way, I think that allowed us to come into this space with a neutral lens and perspective. I think we were able to really sort of bring folks together with the community at the center without hidden agendas. Like, we didn't need funding, we didn't need anything other than thought partnership and deep collaboration to make things different and better in our community. I think the language we used was really important. From the very first day, we talked about ourselves being a steward of this grant, right? It is not ours, it does not belong to us. This is in service to and in partnership with community. And I think that really set an important stage. So as I think about prevention planning, that's just been so critically important for us in this work. We also continue to spend a lot of time thinking about matching capacity with expectations and priorities. So I think it can be easy when we have these opportunities to do big picture thinking. This one is actually me by myself. I could get real big with my thinking. And I think having a team to really say okay, that sounds great, but what are we gonna do for the next 3 months? And how is that gonna get us to where we wanna be in a year? And do we have the staffing and the funding and the partnerships and the depth of relationship to get there? The next thing that I would say is that, San Diego is fairly collaborative. We've been doing relationally oriented work for decades here. And I think we were able to really leverage that in our prevention work. My team and I spend most of our time in meetings or in one-on-one conversations with folks, because this work, systems level transformation work, it is relational. And so we probably combined, we attend probably 40 community meetings a month. We are out there, we're listening, we're learning, we're contributing, we're cross-pollinating. And I think that is the most important thing for how and why we've been successful so far. We have also spent some time talking about, pretty candidly and transparently, self and shared interest. So we have both sort of systems level leaders and decision makers, as well as direct service providers at our leadership table. And I'm sure many of you have experienced this in many sort of settings. But what we started to see was, as the work started moving and things started shifting to primary prevention, there was this sort of oh wait, what's the implication for my program? Am I gonna have to reduce staff? Or if we really catch families' needs upstream, is my program even needed anymore? So I just think as we started to see that, because we had the relationships that we had, we called it out, and we are still having those conversations and honoring that there is this tension, right? Even though we want what's best for the community, we also deeply believe in the things that we're doing. And so how do we balance that? And how do we re-envision together what new roles and responsibilities can be in this transformed system? I kind of talked about cross-pollination before. We just spent so much time doing this, and I would just say it took us a minute to figure out how to document it, how to connect the dots internally to then be able to connect the dots externally. So sort of the internal process work, it took us much more time than I actually anticipated, but I think it was well worth it. Otherwise we would have just ended up doing things sort of in this disconnected way. this one is me. I'm going to take credit for this. Dream big and then build from where there's alignment. So I think we had some folks who were sort of wanting to start realistic. And then I think we sort of together got to this place of like, we got to start in the aspirational and then scale back to like what's realistic in like given time and capacity and funding. But when we talk about, are we doing like tinkering work in the beginning? I think we probably would have said we're doing tinkering work. We're just playing around the edges. We're trying to make things a little bit better. I would say now we're doing reform and transformation work. If you ask anybody on our team or our core team or our partners, I think we have gotten to this place of sort of authenticity around that, but that's not where we started. Okay, so I want to talk a little bit about our lessons learned, and then just some considerations. So the first is, this is a no-brainer. Everybody's always talking about this, nothing about us without us. I would just say, like, we didn't do a very good job of that in the beginning. And I talked before about this. Commitment to equity has been an inside-out process for us. I think we also continue to struggle with this idea of how much, like, of course, we want to be inclusive and we want to co-create and co-design, and folks have full-time jobs, and so or are like volunteering their time, or they're being compensated hour by hour. Like, this is our job. We're a backbone organization for a collective impact effort. We are funded to wake up thinking about this, and well, maybe not go to sleep thinking about it, but we might. And so how do we kind of take like the responsibility of that, but also not hold the power of it? And so I think trying to figure out like how baked do we get things before we share them? Do we start from scratch? Do we have the ingredients out on the table, or are we following a recipe? So just figuring that out at each piece. The other, and I've kind of talked about this, like for us, this has not just been about convening partners. It's also been about going to where the work is already happening and honoring that. This work takes time. Relationships take time. Innovation takes time. Transformation takes time. And so it just requires patience. And that is not always like a comfortable or preferred pace for folks. I think the other thing we're really starting to see as the commitment to prevention is becoming a reality is this challenge or this tension between meeting immediate community and family needs while also getting upstream. So how do we sort of like balance the skills with that in a way that's responsive, but also not keeping us stuck in where we've always been? And then the last piece is just the how we do this work matters as much as the what, like what the actual thing is that we're doing. Okay, I have 3 minutes. I'm going to try to get through these last considerations. If not, y'all will have the slide deck. So the first is what you've heard me saying this whole time. What's going well? How do you build off of it? Where is there momentum and energy? What is the why behind your prevention work, and who is it intended to benefit? So we had to do a deep dive. We did a root cause analysis. We spent a lot of time on it to really understand what are the ways that our current prevention planning may be inadvertently perpetuating inequity, and what do we need to do about it? And we had to be real honest looking in the mirror around that. What are the gaps or needs that your prevention plan could possibly address, especially thinking about FFPSA? I talked about inadvertently the perpetuating piece. And then how do you keep the experiences, hopes, and aspirations of children, families, and caregivers centered in your prevention planning, right? So this is kind of about inclusion, and that can look so many ways, but just like we can get system level thinking, and then we always have someone who says like, okay, but what does this mean or matter to a family that lives down the street from you? And I think that has just been such a beautiful and grounding lens for our work. So I'm going to stop there. I know I talked really fast. I'm always available to chat. I love this. This is an amazing time to be in this field. And I think I also missed like a bunch of questions. So I don't know if we have time, but.
Well, I think that there was a lot of compliments to the work that you're all doing. I know that there are some folks that wanted to ask about if there's any academic or research organizations assisting you. What can frontier countries do to entice academic research organizations within their counties? That's a great question.
So we work with both San Diego State, UCSD, and Harder and Company as a local evaluation company. We also have technical assistance support from the Children's Bureau. I don't know your community, but I would say that we didn't ask academic institutions for help, so they didn't help us. But as soon as we reached out and asked, they were so happy and grateful. So I don't know that that's a helpful answer, but that's kind of what happened here. I think you asked another. Oh, frontier counties. Oh, I see. So sort of like farther out. I would just say, I think that like so much work is happening remotely. I think there's probably lots of opportunities to engage with large academic institutions.
There's also a question about your early childhood mental health funding. I'm just wondering where you're funding, or how you're funding that, I should say.
Yes. So it's a hodgepodge. We are piecemealing together, which is not sustainable. For a long time, we were funded through our first five, through our healthy development services, but it didn't actually, it covered behavior support, but it didn't cover early childhood mental health consultation. And we just made it, the timing was right for us to go sort of our separate ways. So we get grant funding. We did have to offer the service as a fee for service for a minute because we just didn't have the funding to sustain it. But it also caused us so much heartburn because of it's an equity issue. So I would just say we are hitting the pavement every day to bring in funding to cover the costs. But that's why we want to pull together this work group, because others are in the same place. And this is an amazing resource that serves early care and education, the K-12 system, behavioral health, first five. And so I think there's some new opportunity with new funding, Medi-Cal reimbursement. Like, I think there's some like legislative things that may be happening. There are some things happening at the state level with early childhood mental health yet, but we're not there yet like other states are. So, we're just trying to hold it together so we can build a sustainable system is my answer. So if anybody has any tips, please send them to me.
Thank you for that transparency. Sometimes it's about being creative. Someone just asked if CASA was a partner in your work.
Yeah, so I would say they are a partner, not in our advisory committee, but I sit on our Child and Family Strengthening Advisory Board, which is our CAPC. So there's cross-pollination. So I would say, yes, we're partnering for sure. But like, again, it's not necessarily like on our partner list, right? Does that make sense?
Great. Well, thank you. Excuse me. Unfortunately, we are going to close out our day, but we appreciate all of the questions. I'm pretty sure we got to all of them, but the feedback in the chat has just been really amazing. Lots of great feedback in the wonderful work you're doing in San Diego, and you represented your team so well, Aime. I love the passion and the excitement you always bring, and we felt that today, and it was such a wonderful representation of the message that Alex gave to us earlier. So this was a great concrete example of what we would love systems to start to become. So thank you.